An expectant mother is among patients undergoing treatment in the infectious disease unit of the Kenyatta National Hospital. The doctors say both mother and child are doing well, but warn she will need further attention to secure her well-being and that of her child, owing to the emotional toll the virus has had on her. Tonight, Leila Mohammed looks at how, in the age of this deadly virus, new life hangs in the balance and explores the measures taken to protect expectant and young mothers and, of course, their children.
An exclusive peek into the front line in the war against COVID-19 brings home the reality of a disease that has the world in its grips. In one of the cubicles here, Nation journalists who were granted rare access into the isolation facility caring for COVID-19 patients could only quickly wave at a young expectant lady. She waves back and slips back into her world. She's careful and stable, but her doctor can only see her from the door. They are hopeful that she'll make a full recovery. Many miles away in the United Kingdom, a community gathers to contribute towards the upkeep of a baby orphaned by a mother 2 days earlier. The mother, 28-year-old Mary Agyeiwa Agyapong, had worked for 5 years at the Luton and Downstable University Hospital. She was admitted to hospital on the 7th of April, having tested positive for the coronavirus. And while doctors managed to save the baby's life, she unfortunately succumbed to the disease. In Kilifi County, Mishikitsao cuddles one of her 4 bundles of joy. She manages a smile even as she tries to ensure that each of her 4 one-month-old babies gets the attention they need. The baby girls were delivered 4 days after Kenya announced its first coronavirus case, with the pandemic filtering through to the most remote nerves of the country.
Alipata uchungu akiwa nyumbani na akawazaa watoto wote 4 nyumbani. Siku hiyo moja walitoka mmoja baada ya mwingine. Na walipotoka wakawa ni wadogo sana. 4 mmoja alikuwa na kilo 1, wawili walikuwa na kilo 1 na hao wawili walikuwa na 0.9.
The girls were born underweight and have been at the Kilifi County Hospital's high dependency unit. The doctors fear they may get infections and should be cared for at home. But their mother fears she may not be able to meet their nutritional and basic needs.
Tatizo letu kubwa sasa imefika wakati hao watoto lazima mama aende nao nyumbani. Sasa tunapata wasiwasi. Hapa tumewalea katika mazingira ambayo yako control, inaweza sema. Usafi wa hali ya juu, kulisha, mama hana maziwa, inabidi tupatie ile formula milk. Sasa ukiangalia hali ya Mishi, hawezi afford vitu kama hivyo. Hawezi afford. Mumewe anafanya kazi ya ujenzi, hana kibarua. Kule nyumbani anakotoka, anaishi katika familia extended. Anaishi kwa Mavia. Mavia mwenyewe ako na nyumba ya room 2.
Mishi, who has 3 other children, says despite her fears, she is grateful for the blessing, and every time she cuddles them, she prays that her family will weather this storm. She is a testament to the dizzying and disorienting changes that expectant women face in the age of the coronavirus. Across the country, expectant mothers and those who have recently given birth are confronting an unanticipated layer of stress due to the coronavirus. Healthcare workers have had to rethink how best to offer prenatal care at a time that people are being advised to stay at home. But for many of these women, there is solace in the fact that they are not alone. In Nairobi's sprawling Mukuru Kwanjenga slum, Florence Wambua is making French fries for lunch when we visit. She admits that this is one of the few cravings she has been unable to shake off since she became pregnant. And while she could have easily bought the fries from a local food vendor, she prefers to make them herself to avoid endangering herself and her baby.
Hata kutembea sahi, hata ukitaka kuendea mboga ni shida. Itabidi unakaa tu kwa nyumba.
For many women like her, the monthly checkups at her local medical center are key, but they have to be planned with precision. The night curfews and transport challenges occasioned by the restrictions on movement have compounded her woes.
Mtu anaweza shikika anytime. Yani anaweza ngojeka usiku. Sasa nilikuwa nauliza kama maaskari wanaweza umukienda usiku wasaidia hapa kwa barabara juu saa hiyo ujui utapatana na maaskari wako aje.
For Mutheu Mutuku, who is admitted at the Makueni Mother and Child Hospital, the realities of the current night curfew hit home when labor pains struck 4 days ago.
Ilikuja nikiwa nyumbani around 4. Sasa ikakuwa siwezi ita mtu wa taxi juu ya hiyo curfew. Sasa tulimuita akatuambia tugoje mpaka 5. So we had to wait mpaka 5.
Here at this one-of-a-kind unit based outside of Nairobi County, the county management team in charge of health says they have ensured that movement in and out of the facility is restricted to key personnel and few family who come in to visit the mothers. While all who come in are required to wash their hands and sanitize their shoes and take a temperature test before gaining entry into the wards, wearing of masks is only left to the adults here.
We don't give masks to our babies, and that would maybe compromise their breathing mechanisms because they are small. So what we usually do is, because they are usually born in the unit, all the mothers have masks, and the service care providers, or those that are coming in contact with them.
The hospital administrators say that while a huge percentage of the mothers here delivered at the facility, they are now receiving an equally significant number of referral cases from hospitals within the region.
Nilianza kuumwa jana asubuhi, nikazidiwa jioni, nikaenda hospitali nyingine private Kikoko, nikazidiwa hapo, nikapewa referral letter.
Like now we have only 5 mothers who have delivered normally, spontaneous vertex delivery, and about 13 who have gone through cesarean section. And we have been able to really space them more than a meter so that they are safe.
In Bungoma, Wilfrieda Mganda has had a hard time keeping up with her baby. Young Daniela is just learning how to crawl. She has also been weaned off milk and now has to be fed on a balanced diet.
Imelazimika mtoto wangu ameanza kunywa uji wa mahindi juu ile wakati nilikuwa naenda supermarket kutafutia unga, sasa sina hiyo uwezo.
She knows hygiene is key during this difficult time. While she has access to water, she says she cannot afford hand sanitizers.
Mimi kupata maji si shida, lakini hiyo sabuni hiyo sanitizer yenyewe ndio ngumu.
Her experiences and challenges as a mother away from major cities are not so different from those mothers living in slum areas in towns like Nairobi.
Niko na mtoto mdogo na kila mara ni kusanitize. Saa zingine unapata nimesahau juu ya kusanitize. Alafu ile kupata pesa ya kununua sabuni pia unapata ni hiyo kunini ni ngumu.
Those who delivered and needed to go for checkups say that their clinic visits to public hospitals have considerably changed.
Ausgal wangu alikuwa aende anibebe mtoto, lakini kwa hospitali hawakubali uingie na mtoto na mtu yeyote. So ni mimi na mtoto tu tulipimo hiyo joto tukaruhusiwa kuingia na sina ile nguvu ya kubeba mtoto.
At this unit in Bungoma Hospital, mothers with preterm babies continue to fight their own battle to keep their delicate young ones warm, with the medical personnel here keenly checking up on them to ensure the raging battle against the coronavirus does not creep into these walls. Leila Mohammed, NTV.